What being a game changer in healthcare means to me is that everybody in our country, man, woman, and child, has access to healthcare.
A game changer in Oakland would be, for me, getting the youth to stop other youth from eating unhealthily. Like, having friends tell friends the effects of what junk food and energy drinks can do to your body.
I think nonprofits change our community in general by filling in many of the gaps that exist in our community. We created the FACES Summer Medical Academy back in 2005 in response to inquiries from the community about creating something for young people who wanted to go into the health careers, in particular in medicine. There weren't very many activities or resources out there that would expose young people to what it was like to be a doctor.
So FACES is a program where we get to learn all about different medical professions that you could do in your life. It introduces us and it helps us see if we're passionate about it, and it's basically a 2-week program just of introducing us to all the different kinds of medical professions and all the different kinds of medicine you can practice. I want to be a nurse.
I want to be a pediatrician cardiologist.
I want to be a forensic pathologist. So they're kind of shaped, I actually just learned that term. So they're kind of shaping of the specific thing I want to do, and that's what I really love.
We very deliberately created a program that not only trained people in kind of some of the basics of clinical skills, but also trained them in skills on how to interact with people in a compassionate way. So the workshops that we offer the young people today focused on the very aspects of what we call simulation learning. This idea that you are placed in really exciting clinical scenarios without the fear of working with real people.
There we go. Right here.
I got really nervous with the patient we had because I didn't know I could talk and know your name and talk with you back. I didn't know nothing of that. I thought it was just a doll that doesn't move. So it really gave me like a feeling of experience of this is real life, this is how it feels. And I got really nervous, so now I know that I need to work on that.
With FACES, I got to see what it was like to be in a tough environment and be very professional with the staff and be able to communicate. And I also learned what I didn't want to do. I realized I don't want to be in a hospital. But it also allowed me to participate in what I do want to do, which is work with nutrition. And I got that chance by being in the partnership with KDOL, and we made videos about nutrition and the obesity epidemic.
Hello, good afternoon, and welcome to Counting Calories. My name is Lapson Barrera. We have assembled a tremendous show for you guys today. We have 2 high school students competing to make the right choices and make it through their day the healthy way.
Creating this video with KDOL was really fun, and I learned how to use technology, and I realized that I was making a mark on Oakland's community.
Diabetes in a cup, everybody.
Because I learned that I want to go into public health, and I didn't know that until I did that.
Stop! Do you know what you're eating? Do you know where it comes from?
It's fried chicken from a farm.
You may think of a farm as a happy place, but really it's more like a factory. They feed the chickens genetically modified corn and chemicals until it's too fat to even walk. Don't let them do the same to you.
Can I get some of that salad?
Sure.
So the reality is that I, as a pediatrician, can offer education and information to my patients, but the message may be a little different because of my age, and because of my status, and because of my role. But a dialogue happening between a young person and another is a very different situation.
I mean, youth aren't going to listen to adults. They listen primarily from their friends, and so one other way to be influenced is by your friends.
I come from an environment where I know some people are drug dealers, gangbangers, girls that get pregnant at 16. And it's a stereotype that I am 16, so I'm supposed to be pregnant, but I'm not, and this is kind of my outlet.
A lot of people think of young people as, oh, you can't trust them, they don't know what they're doing, they're irresponsible. But at Faces, they make sure that the staff at the hospital trust you, care about you, take you seriously, and they do take you seriously.
Faces is a game changer because they give kids like myself an outlet out instead of doing typical stuff teenagers do. Typical teenagers do, you know, the parties, the drinking, the whatever they may do, but to actually take the time out of my summer and think about my future, you kind of get to change the game. Because with your new discoveries and your new questions and coming together with people you don't know and figuring out, okay, so this is the problem, how can we fix it? That's the game changing of Faces.